Welcome back to the Well Said Pod. This episode I'm personally really excited about. We've all seen the shift, a heavier focus on skincare, aesthetic treatments, skin procedures. But how do we really know what's good for us and the right way to go about things if we choose to do so? So today I have joining me Dr. Sachin Dhawan, one of the top dermatologists in the country and someone I personally trust with my skin. Dr. Sachin is known for his skill, but also for his balanced and real approach to skincare, which really works. So we're going to get into it. It's going to be all about procedures, aesthetic treatments, skincare, Botox, fillers, pigmentation. So let's dive right into it. Okay, so Doctor, first, I really want to thank you for taking the time and being here today. I know it couldn't have been easy for you.
I'm really glad I'm here. Thanks for inviting me.
So I was really excited for this podcast because I feel like I love your approach when it comes to skin. I feel like it's the right guidance, and as your patient, it feels like your approach is that, to give your skin what it needs instead of overdoing it.
Absolutely. In fact, there has been a lot of overdone faces that you see around. If you walk into a social scene, you'll see 30%, 40% women who are overdone. And I strongly believe that overdoing treatment is not a good idea. Treatment should be according to a person's age, need, and also, sometimes as a doctor, I have to guide a person that, you are going overboard now.
Yeah.
Because as a patient, it's very difficult for them to realize. They see themselves in the mirror every day. They don't see the changes that are happening on their face. So as a medical practitioner, it's our duty to actually guide people that what is the right direction to go in.
But do you feel that's common where doctors are warning their patients about, okay, you are going overboard? Or is there a lot of, or in clinics, is there a lot of marketing that's happening to sell the treatments?
So I think unfortunately there's been a sort of outburst or overburst of a lot of cosmetic clinics which are not sort of owned by individual doctors.
Yeah.
So in such places where it is more corporatized, where profits are given importance, a lot of times misguiding treatments are given. But any sensible doctor, any senior person who knows you well and who knows that you're in a relationship with a patient in the long run, not a short-term thing, not looking at monthly profits, so they would guide you right, and a lot of doctors do. So I would in fact want the viewers to actually be wary of such places. Do your due diligence. Sometimes if you have heard that your friend has got treatment over there and they are referring you, that could also be because the friend is being offered a discount for the number of people they bring in.
True.
So do your due diligence and probably go to people who are established and where their sensibilities resonate with your sensibilities. If you want a natural treatment, if you want prejuvenation versus overdone face, go to a doctor who does prejuvenation. Not everybody does that.
No, that's true. I feel like commercializing something in the healthcare industry, like that can't go down well.
Absolutely.
And with the kind of trends we've been seeing recently, I want to ask you, which skincare and procedure trends are you seeing in 2025?
I think the last 6 to 8 months, what's really trending is biostimulators.
Okay.
These are injections which stimulate collagen, fat, prevent cell senescence, which is cell death. So we have 3 or 4 stimulators that have become available. Profilo has always been there. It's a product that is about 3-4 years old. But we are seeing more of exosomes. In fact, bone marrow derived exosomes are available. Earlier they weren't available, human exosomes. Then we have PDRN, which is also called salmon DNA injections.
Right.
That's very trending. There are a lot of products also which have PDRN, but injectable PDRN is also very commonly being done now. Then there is something called the NCTF 135, which is nucleotides and hyaluronic acid and vitamins and minerals injected in the superficial layers of your skin. So these are the 3 biostimulators which we are seeing are trending in the last 6-8 months. And there's more awareness about them. Some of the awareness has been created by social media personalities also. But, again, like I said, go to a doctor who would advise you what is the frequency at which these treatments have to be done, or they are the right fit for you or not.
So what would the benefits be for these trending treatments, and would everyone be a candidate, or are there exceptions?
No, I think these treatments are good for everyone. It's just that you have to find the right age where you would start them. somebody, let's say, who's in their perhaps 20s, I would not really suggest these treatments for them. Yeah. Because biostimulators are needed when you start to age. Yeah. And typically you start to age post 25. We used to say 30 earlier when I started out 25 years back. It was said that 30 is when you start to age. But I think with high pollution, high stresses, a lot of screen time, the first signs of aging now appear at around 25. That's the time you should start taking care. We normally advise people to go for a more natural treatment like a PRP or a growth factor concentrate GFC injection, because that's your own natural cells, your own blood, which is being used. And slowly, as you move into your early 30s, you can look at these treatments. That's quite interesting, because one of my questions was whether people are seeing earlier signs of aging now, in the sense that they're seeing it earlier than they normally would. It is happening, no doubt about that. People used to be in the prime of their skin till the late 20s earlier. But now we see a lot of young kids who are in corporate jobs, or who are probably studying abroad, who are doing night studies. So they get under eye hollowness, lines, darkness. Wrinkling happens at an early age that way. People are worried all the time. They're looking at screens all the time. So frown lines, forehead lines are happening at an earlier age than before. That way. At the same time, an equal number of people are very aware of it, and they are taking preventive care right from the beginning. But you'll be surprised, we get a lot of people who are also taking it to the other extreme. They start taking care of their skin to prevent aging as early as 8 or 9 years of age, which is really ridiculous, actually. I've never heard this before. No, we have a lot of young boys now who come in saying, I want a skin regime to be made for me. 8, 9, 10, 12 years. They're already using retinol. They're already using vitamin C, niacinamide. I'm seeing this trend in the last year or so. I think that's social media, while being very important for information dissemination. One has to, even as social media personality, one has to really tell people that, this is meant for a certain age, and it should not, you won't have the same regime for an 8-year-old versus a 20-year-old or 25-year-old. So there are a small number of people who are unfortunately, using these products too early. So is there a right time to start skincare? So skincare as a word, I have an objection to it, because skincare obviously you'll do from as soon as you're born, right? As you're born, you will use your moisturizer, you probably would use a body oil. So that's also skincare. But if we talk about a regime to be started, then a regime should be started at a reasonable age. If you're a teenager, obviously you need a regime at that time as well. You'll use products which are perhaps meant for acne-prone skin, oil reducing, protect you from tan, etc. When you're in your 20s, then you would need something for radiance. When you're in late 20s, when an actual skincare regime should start, which should have perhaps 2 to 3 steps in the morning and 2 to 3 steps in the evening with all the right products. Yeah, I feel people are starting a lot earlier now, like you're saying. In some ways, I wish I did. Looking back in school, I never put sunscreen. I would be in the sun for like 6-7 hours a day. Absolutely. But like you're saying, we're seeing the other extreme, which kind of brings me to something I wanted to discuss. Is preventative Botox a thing? Because a lot of people now talk about getting Botox at a younger age so that those lines and signs of aging don't form in the first place. Yeah, I think that's a favorite topic of mine. So preventive Botox is a thing, but it is a thing for a small number of people. Okay. You will see a lot of people who have hyperdynamic muscles. They move their muscles a lot. They keep frowning. So those people should do preventive Botox. Okay. So that in their 20s, they don't develop lines. Maybe not even in their 30s, they should not develop lines. But somebody who's got good skin quality, who's not, too, I would say, visually the movements of muscles are not too much, they can wait. Because the disadvantage of doing Botox very early is that you also get disuse atrophy of muscles. Okay. When you don't use them, Botox is making your muscles not move, right? Right. So when you don't use them, like if you don't exercise, your other body muscles also will atrophy. They'll become thinner. Similarly, your forehead muscles, your muscles around the eyes would become thinner if you don't use them. As a result, people start getting thinner skin earlier. Okay. And as your muscle tone reduces, even eyebrow drooping can happen at an earlier than usual age. That is why, preventive Botox, if you're a candidate, the doctor judges that and says that yes, you require it, that's great. But if you're too young and you have overall good skin tone, you don't have enough fine wrinkles, then it is okay to wait for a little longer.
Okay, so doing preventive Botox, if you're not the right candidate, let's say, then it can actually do more damage to your
In the long
skin.
run, yes, it can do that, because I've seen people who started doing Botox at a very early age. They would get muscle tone issues where eyebrows are not as lifted as otherwise would have been, and they start getting slightly enlarged veins also. Oh, because the skin has become thinner. Right. So there's a right age of doing it. Typically, unless somebody has very active lines, I don't like to do Botox before the age of 30, ideally. We get a lot of people who are in their mid 20s and who do it, and they are the candidates for it. That's why we do it. Technically speaking, they say that before 18, one should not be doing any injectable treatments unless medically indicated. Somebody who's got, like, I've had 16-year-old girls who come to me and their mothers have bought them in saying that, please do lip filler for her because that's her 16th birthday gift. And I've done it for them also, because those are girls who have been conscious about it and they genuinely had a problem. But somebody with absolutely perfect lips who would come to me at 16, I would tell them not to do it. Right. Yeah, I really wanted to talk about lip fillers because, of course, it's a complete personal choice. People don't talk about it openly as much, but of course, we know it's common. We have seen the shift happen. Right. But I want to know that what does one need to know before getting lip fillers? And like you said, like bio-individuality is a thing. True. So is there any such thing as a right or a wrong candidate for lip fillers? So I think wrong candidate would be somebody where the dentition is not right. If somebody, let's say, have an upper jaw which is bulging out, and if you do a little bit of lip filler for them, it will give them a duck-like look. Right. So that's, and you'll see plenty of faces like that, when you move around the social circle. So when you do lip fillers, you don't have to look at only the lips. Okay. People talk about proportions, people talk about projection, people talk about, how the cupid's bow is. That's important. Yeah. But you also have to look at dentition. Are you missing a tooth, or are your teeth malaligned? Is your, upper jaw projecting out? Is your chin projecting back? Because then you have to treat the entire area. Then you get best results. There's Invisalign available now. A lot of people are doing that, and their faces are changing because their dentition is changing. Right. Even without doing a lip filler, they get a balanced appearance of the face. Similarly, if you have a retrographic chin, which means you have a short chin, which I would say about 20% to 25% Indian women have, then you need to balance the chin by doing a chin filler also. Okay. You have to look at the position of your nose as well. If you have a bulging nose plus you have bulging lips, it won't look nice. Right. So look at multiple things. And if you're an older individual where the lips have curled in, you would also want to lift the cheeks up a bit before doing your lip filler. Because if you have sagging face and then you have, projected lips, it's a sure giveaway that you got something done. The beauty is that, if you leave a person guessing, has the person does it or not? Has the person done a filler or not? So then if you can make out that you did a filler, then that beauty is lost. Defeats the purpose, yeah. Yeah, defeats the purpose. Fortunately, as practitioners, as injectors also, people are getting more and more aware of that. Some patients are also getting more aware that they should not have an overdone lip look. Yeah. The sausage lip or the Russian lip, as they call it. That should not be there. So important thing is that when you go for a lip filler, you look at these aspects, go to a doctor who understands these aspects. Number one. Number two, look at the entire face. Number three, talk to the doctor. What product are we using? Are we using a hard product or a soft product? Okay, and how does that affect the lip filler? See, a hard product will stand out that way. So if you have very, very thin lips, maybe initially you can do a soft product and the second time you can do a harder product so that you can have better height of the lips. And if somebody has a reasonable volume, then they would do a softer product so that they only get hydration. Because even if you don't increase volume, but your lips are looking hydrated, the lines are lesser, it also looks nice. That way. Yeah. So post-procedure care is important. Yeah. You have to understand that any filler can have a side effect where it can block the blood vessels of that area, and that can cause cutting off of the blood supply to the skin, and you can have blisters and some scarring then. You need to reach out to your practitioner as soon as possible so that they can dissolve the filler so that further inflammation and damage does not take place. So you have to be in touch with the clinic or with the doctor who has done the procedure for you in the first day or two and report back anything abnormal that you see. Right. And with fillers or with any injectables, I always tell people don't do it just before a very important thing.
Because you don't know how you're going to react to it.
Yeah, like recently, there was a person who had a business opening. Her business was opening in Dubai, and she wanted to do a lip filler like 5 days before that. I told her that you won't be happy because you'll have swelling for the first 4-5 days. You will be in stress, and then stress will impact healing. So always try and do injectables, especially lip fillers, when you have 7 clear days when you don't have anything very important socially, because it takes 4 to 5 days for the inflammation to subside and 2 to 3 weeks for the lip filler to integrate with the lips to get the final shape.
Right.
And don't be in a hurry. So we get a lot of people where they say that, doctor, your appointment is not available. I went to this doctor. And then they come back saying that, this happened or that happened. So go to your trusted doctor. Even if it takes a little bit longer, plan these things out. Don't leave it for the last moment.
Right.
Okay. Bruising is common after injectables, so you have to account for that. If it happens, it takes 8 to 10 days to go away.
8 to 10 days. Yeah, it's really good to hear this, because people who are getting lip fillers or considering it, there's no reliable source of information where you can go and get clear answers on what to do in a way which is completely unbiased and really giving the real picture. And I think it's so interesting what you said about how you have to look at the overall face and not just the lips.
Right.
Like in the case of lip fillers, for example, people might just say that I want bigger lips, and that might be something they idolize or a trend that's going around.
True.
But I hope a lot of people understand that it's an overall face and how that's going to fit into your look to enhance how you're looking.
Absolutely. And, it's not one size fits all. You can't make, people sometimes bring a picture saying that, okay, this is a celebrity I idolize and I want persons this type of lips. You cannot really exactly match them because they already had a certain structure, and perhaps with the filler they enhanced it. Now you have a different structure, so you cannot make exactly look like that person's
someone
lips.
else.
Yeah,
of course. And coming back to Botox, we were talking about preventative Botox, but now people who, let's say, are candidates for it, what can one realistically expect for it? How long does it last? And also after that, I want to know whether people, what they do if they have bad experiences, or how do you know Botox has gone wrong?
So I would say that even a best practitioner would still have a few cases where unexpected outcomes of Botox will come. Because when we inject Botox, it's going in your muscles. There are spaces in muscles. It can move away from that particular tiny muscle and go to another muscle where, you can have an eyelid droop or asymmetric eyebrows when you're doing upper face Botox. With Botox, fortunately, that is all that can go wrong. These are reversible things. If somebody has a droopy lid or a flatter eyebrow, by 4 to 6 weeks after the procedure, it starts to get better.
Okay.
And as we know, Botox itself only lasts for 3 to 4 months.
Okay.
Unless you overdo it. The adverse effect would only also last for that long.
Okay.
So Botox doesn't have any long-term negative impacts. People talk about Botox reaching the brain and going to the bloodstream, etc., etc. Those are, even if micro doses sort of go to those areas, they are not adversely impacting our health in any way.
Okay.
Also, the quantum amount of Botox that you do is important. Like a lot of neurosurgeons for neck tightness, etc., or trapezius strap tightness, they do about 300, 400, 500 units of Botox in one go.
Okay.
As aesthetic physicians, we end up doing only about maximum of 100 units for a person. Average is about 40 to 50 units for a person.
Oh, wow.
For the upper face. If they're doing lower face, then it's about 100, 120. So as a result, because the dose is lower, adverse effects away from the area of injection are not there. So, if you see somebody having asymmetry, if eyebrows are symmetric, you can go back to your doctor and they can try to correct it. If somebody has a slightly droopy lid, an eye drop can be given, which helps to reduce the droopiness, and eventually in 4 to 6 weeks, it goes away.
Okay.
So, nothing majorly goes wrong with Botox, and the longevity is 3 to 4 months. Some people say that, I did it and I've not had the need to do it for the next 6 to 8 months. Those are rare cases, I would say.
Yeah. So
most others would need to do it thrice in a year.
Okay. What's a sign of overdone Botox?
Normally droopy lids.
Droopy lids. And that's so counterproductive as to what I'm presuming what they would want when they're coming in, because you want to lift, right?
Lift. Droopy lids happen when you do a lot of Botox on the forehead or do it very close to the eyebrows. So then this entire area stretches and the eyebrows become flatter.
Right.
The inner corners droop down like this. And if, let's say, you inject for the frown area and through spaces it reaches the eyelid muscles, then you can have an eyelid droop also. Even, like I said, with the best practitioners, there will be one in perhaps 500 people or 500 treatments who would have these effects. Fortunately, they're temporary.
Okay, so nothing to as such worry about.
No, nothing to as such worry about. If there's a lot of droopiness, then you can talk to your doctor or maybe consult another doctor and tell them that, these are the units we used. This is what happened. Please see how we can manage it. We've had a couple of cases where they had these issues, and next time when they came back, we made some permutations and combinations, reduced the dosages, diluted and did baby Botox. Okay. And that resulted in people, feeling happy, and they continue with their treatment.
So we understand that Botox doesn't affect your health in ways that people might assume, but we've been hearing a lot about filler migration and that it shifts, especially in areas like lips, which tend to move more. So is that a real thing?
No, filler migration is a real thing, and filler persistence is a real thing. When we were taught filler, we were told that these are totally biodegradable, bioabsorbable. Within a year, all of it will go away. In the last 7-8 years, we realized that doesn't happen. When you put, let's say, an ml of filler in an area, based on how mobile that area is, based on the person's individual capacity to sort of dissolve and break down hyaluronic acid with the natural hyaluronidase enzyme present in our body. On an average, what I found is that only 50% of the injected material dissolves in 1 year. So when you tell the person to come back a year later, they still have the previous year's 50%. So then either you do lesser, or if your goals are further enhancement, then you do the same amount, knowing that it will be more enhanced, more full than the last time.
Okay.
There are certain areas which are hypermobile areas, like the outer corner of the tear trough, where the fillers tend to almost entirely go away in a year's time. And also lips, which are very mobile, there they tend to go away faster. About lip filler migration, again, product choice will make a lot of difference. If you're using a harder product, which has got more hyaluronic acid in it, then it tends to stay for a longer period of time, and there's a chance of migration then.
Okay.
But if you use a softer product, which is more compatible with the lip tissue, it absorbs better, it's a mobile one. Like, the hyaluronic acid is in chains which are joined together. So if the cross linkages are lesser, it's more mobile. Right. If the total amount of hyaluronic acid in the filler gel is lesser, it's more mobile. So you need to go in for specialized products for the lips, not use just to get better enhancement, use harder products.
Okay.
So this is very important to know.
That kind of brings me to my next question. You were saying that sometimes patients come back after a year to refill that part, but the filler is still present. So do you think that for people who have got it done, it's difficult for them to see the filler that's already there because they get used to seeing their face a certain way?
Absolutely. Person sees their face every day in the mirror and in the videos now, and they feel that is the normal self. But if you look at pictures a year later, like I have, serial pictures, we take patient photographs. So when I go back in time and look at the patient's pictures for 5 years back, I know they've changed.
Yeah.
The volume is more, and in a good way. But see, adding volume at a young age makes you look more mature, in fact. True. But adding volume at the right time makes you look youthful. Besides, where you add volume is very important. So if you're only working on the cheekbones, it will lift you up with a hard material. If you start to fill the entire cheek area, under eye area, then when you smile, your eyes will look smaller. And you yourself will not feel good because you'll feel a heaviness on the cheeks.
Okay. So as a practitioner, is it easy for you to say no to patients?
I think yes. That's why a consultation is very, very important. Sometimes what happens is people book a treatment directly, saying that, I did lip filler with so-and-so and now I want to do it with you. So I insist that they should consult with me first, see if there's actually a need to do a lip filler or not, or a cheek filler or not. Or if they're looking okay, then we tell them to do other things. Maybe a softer filler for hydration for the lips can be done rather than a volumizing filler. that way. So it is difficult to say no because people have a fixed idea. And I know that 50% of the people I'll say no to, they'll go somewhere else and still do it.
Yeah.
So that's why I offer them solutions which are in which they don't look too bad, but they're still happy that something's been done.
So you kind of come to a middle ground.
Middle path, yeah.
But okay, so moving from injectables to skin treatments, topical treatments, like whether it's lasers, peels, hydrofacials, PRP, there's so much buzz right now. So how do people know what is good for them versus what's just a trend? And on a side note, I know that I've personally come to you so many times saying I want to do something about these marks, I want to do some kind of facial, I don't do anything, where I have been stopped and told that let your skin just be at a normal baseline before you think of any kind of treatment. Yeah. So many facials and treatment options today, from hydrofacials, PRPs, it's endless. So how do we know if it's just buzz or what would actually work for us?
So I generally say that, if a new trend is trending, allow 6 months for it to settle down.
That's a good way to go about it.
Allow 6 months. If it lasts more than 6 months, then that's the real deal. Besides that, again, going to a good doctor who understands science and who would be able to differentiate between a good treatment or a passing treatment is important. So that's where your practitioner will guide you. Besides, if everybody is doing it, then don't do it. Just wait for a little while. It's always better. Yeah. Even as a doctor, when I introduce a new treatment in my clinic, I at least wait for 6 months to 1 year. Because see, unfortunately now, with social media and Instagram, people want to be the first one to break that news. I've started PDR, and then, within a week, you'll see 10 different doctors are posting that I'm doing PDR and we are doing this.
Yeah.
It has great results. And fact is that those videos that they're shooting are actually the demos that are happening for the first time in their clinic. They don't even know what the results would be. So as a doctor, I am very skeptical about starting a new treatment because I know that I don't know enough about that treatment.
Yeah.
I would probably do it for a few people. I'll probably do some workshops, maybe do it for people I know don't have very sensitive skin first, and then perhaps I'll roll it out more.
Yeah. So basically it's one should wait before just hopping on to a trend because it's happening, and 6 months is a good time to
know about the side effects, know about any adverse reactions that people have had.
Yeah, that makes a lot of sense. But yeah, so now that we've discussed treatments, when it comes to more basic skincare, what are the most common skin concerns you're seeing with Indian skin currently?
See, Indian skins have 3 major areas of concern. One is something called pigmentary demarcation lines, in which they'll have darkness around the mouth. They'll have darkness in the under eye on the sides of the face, which is mostly genetic, but it has been accentuated by screen usage and lifestyle changes that have happened in the last couple of decades, where people sleep less, they are stressed about work, etc. all the time. So we are seeing a lot of people with that. In fact, I would say out of 10 women who walk into my clinic, 8 would have that issue of varying degrees. Somebody would have very severe, somebody would have not so severe. Only people who are type 1, 2, 3 skin, which are super fair people, would not have it. Type 3, 4, 5 would have it. And then type 6 skin, which is Southern Indian skin, which is on the darker side, they also don't have that kind of unevenness. So this North India belt has this problem of pigmentation in a lot of people. The second thing that I see for people is adult acne. That is really, really common now. So when I started working about 25 years back, I would say only 2% people older than 25 would have acne.
Okay.
Those were the real oily skin people where they required like an isotretinoin course to actually settle it down. And once you do that course, they would be fine. But now we get almost 30% women who are above 25 either get acne after 25 because of hormonal changes, because of the kind of food that we're eating and kind of lifestyles we live, or their acne persists from teenage into adulthood. Right? So adult acne is one of the most common things that we deal with, especially in the Indian scenario, that because of high pollution level as well. We know that diesel smoke, there are studies that show, which is basically all these vehicles, that is known to trigger a change in the skin microbiome, which causes more acne. It changes the amount of oil that the skin is producing, and that causes more acne. And the third thing that we now see is early aging. So these are the 3 most common things that people come to me for.
And a lot of these can be attributed to lifestyle changes,
Yes.
hormonal changes.
Absolutely. Absolutely. Especially the kind of diet we eat. We know that dairy today is by a lot of people not considered to be good because the type of dairy has changed. People used to have fresh milk from cows earlier. Now it's all processed milk, which is made into a powder, which is packed in a packet.
Right.
And then after that, you have it maybe after a few days or a few weeks or few months. So it's a processed food that you're taking. And sleep cycles really matter quite a bit. Our body is supposed to produce cortisol at a certain level during the day. So it's supposed to be actually the least amount of stress hormone cortisol between 12 to 2 at night. But if you're awake at that time, that dip in the cortisol level would not happen.
Got
the
it.
cortisol would continue to be high because you're on your phone at that time. Your mind is stimulated, your dopamine is high, your cortisol levels are high. Whatever, if you're watching a video, etc., your mind is engaged at that time, so it can't rest. If your cortisol levels do not get that daily dip, then you are in a state of stress all the time. Your body is in a state of stress.
Much longer than it's supposed to be.
Yeah, because you're not getting an off time.
Yeah.
You're on all the time. That's the reason. So that's why we are seeing a lot of stress-associated skin problems.
That makes sense. And speaking of pigmentation, what are the best treatments for that would actually work?
So pigmentation treatments that really work would involve some sort of injectable to brighten the skin color. So we do something called mesotherapy, where we use glutathione and vitamin C on the surface of the skin with a gun.
Okay.
So we put it in the epidermis, the top layer of the skin. Then a Q-switch Nd:YAG laser for a certain types of pigmentation does work. It has to be done at a low intensity so that the skin doesn't get red, etc. And an experienced practitioner has to do it for you. Then see, a lot of times people end up doing chemical peels.
Yeah.
But I don't really like the idea of doing chemical peels. Like some people do Cosmelan peel, or they do this peel and that peel where the skin entirely peels off. It gets bright for a while, and once you stop doing it, it'll come back. The darkness will come back. And during the time when your skin's peeling off, if you're not careful, and it's very difficult to be careful in India because of the kind of sun that we have, then you end up causing more damage than benefit because you're breaking the skin barrier. It's thinning out.
More sensitive then.
More sensitive it becomes. So chemical peels as a means of treatment for most types of pigmentation, I don't advise. But yes, if somebody has an acne induced marks and pigmentation on face, back and all, then I do chemical peel for them. But otherwise, mostly it's either lasers for me, or it is mesotherapy, or there would be some injectable treatment like tranexamic acid and PRP, especially for melasma pigmentation that really works.
Okay.
Melasma is those brown patches that a lot of women have around pregnancy and around the age of 40 years because of hormonal changes they happen.
PRP is something that
PRP with the
work.
tranexamic acid injection into those areas is really, really helpful for that.
So these are the treatments that would help. And when it comes to lifestyle factors, what can people do? Like they might have the gene, but what can we best do living in a city that might be more polluted to take care of our skin?
Yeah, I think sun protection, I say 4 levels sun protection you should do.
Okay.
Number 1 is antioxidant intake should be more, both in terms of an antioxidant rich diet, which is rich in avocados, broccoli, blueberries, pomegranates. These are the 4 top antioxidant containing foods.
Okay.
And also in terms of some supplementation antioxidant. So there are oral sunscreens which are available. So you know that you're going to be out in the sun for longer. Or if you're going for a holiday where you know you'll be out for 2 weeks, then you start taking those supplements maybe a week prior to such an exposure. It will protect you more than a sunscreen would protect individually. But in conjunction with the sunscreen, almost very good protection comes in.
Okay.
So internally, that's the first layer of protection. Second layer of protection is your sunscreen. It should be broad spectrum. It should be reapplied ideally every 2 to 3 hours.
That's an important point.
That's an important part. It should be in the right quantity because people just take one dab of it, one drop of it, and they spread it all over the face. Fingertip unit is very important. At least 2 fingertip units you have to put on your face, that way, which most people don't end up doing because they use sunscreens which have white cast, so they don't like the white look. They use lesser amount that way. So choose a sunscreen that doesn't have a white cast. It has high sun protection of at least SPF 50 and UVA 4+ should be there. Third thing that you can do is third protection is in the form of a physical protection. So if you're out in the sun, wear a hat or a cap and take an umbrella. So oral protection, sunscreen, hat cap, and umbrella. 4 layers of protection have to be there for you to be actually saved by this. And try to not do processes and procedures where you know the skin will get damaged, like swimming. Swimming for me is, for skin, the worst exercise.
Oh no, that's sad to hear.
Exactly. Yeah, swimming is such a lovely sport, but that's how it is. Because number one, most people don't have indoor pools. It's outdoor pools. So you'll have some level of UV light. The chlorine in a public pool generally is very high. It'll dry and dehydrate your skin also.
True.
And the aging process also gets initiated with that. So I generally tell people that if you swim infrequently, not on a regular basis.
Yeah, I get that. That makes a lot of sense. And I thought I was being good about my SPF until I heard all these tips. But to conclude, I want to ask you what your top 3 non-negotiable skincare tips would be that can be universally applied.
Start sunscreen from a very early age. By the age of 6 years, normally I advise people to use sunscreen. That's the most important thing. And use it frequently and don't miss any day. Use a physical sunblock if you feel you're concerned about the chemical sunscreening agents. Okay. That's tip number 1. Tip number 2 is start prejuvenation. Okay. Something like to me, a PRP is a great prejuvenation tool. Okay. People in there, as they cross their 25, 27 years of age, should start doing it. It has no harm. It's your own blood cells.
Maybe I'll come book an appointment for that next time. I'm already thinking. Yeah.
Absolutely. And the third tip for people would be that sleep on time. Because for accelerated aging, that is the biggest trigger. That way. And I also want to talk about UV screens and UV lights produced by screens.
Yeah.
Screens are very close to us and we are in front of them for a large period of our day. It is said that 30 minutes of screen exposure is equal to 5 minutes of sun exposure. So if you're in front of screens for 8 hours, that means you're in the sun for maybe 30, 40 minutes.
Oh my God.
So yeah, an important part is that the sunlight comprises of 3 types of UV radiation, UV A, B and C.
Yeah.
C is actually cut out by the ozone layer because it's the most harmful one.
Okay.
B reaches the skin to some degree and A is what causes tanning, etc., etc.
Right.
But our screen lights are producing all 3 types of UV light. So A, B and C. So long-term exposure is not so great for the skin. So improve your screen habits. If you don't need the screen, switch it off. Keep it at a dim, brightness, not too bright.
Yeah.
And try to be as away from it as possible. And especially night screen viewing has to be minimal because at night your lights are off, the screen brightness is up. And it's right up there on your face.
Right. Who knew that, your screen light can be that damaging to your skin? I mean, screen time is a big topic in general, but we didn't know that it impacts our skin on such a deep level as well.
Yeah. That's why they call it sunscreen. So you need to protect it from sun and screen both.
Both of them. Yeah. I'm going to keep that noted. I think that's such a good topic to conclude on. It's been so real and it's such an approachable topic, and I feel like there's so much for everyone to learn, especially coming from a doctor and practitioner like you, where we know we are getting accurate information in the most real way possible. So I really, really want to thank you once again for taking the time and helping everyone watching this video.
Pleasure's all mine. Thanks for calling me here.
Thank you.